As the tidal wave or the epidemic of chronic disease is hitting the majority of our population now, we're realizing the necessity for fundamental lifestyle change.
The healthcare system in this country is absolutely broken. It's based on illness, not on health.
We really need to change our healthcare system from one of disease care to health care.
When you treat a disease or illness, you typically want to get to the root of the problem.
To stop focusing on diseases and thinking of people as an illness and thinking of them as a whole person, and how do we make this whole person better?
What we have been doing in modern American medicine is treating the branches.
The traditional Western allopathic medical approach is limited. It's invasive, it's expensive, it's dangerous in many ways, it's high-tech and low-touch. Touch is an incredibly important part of healing.
The mission of the Casey Health Institute is to fundamentally shift from a disease-focused medical model to a wellness and health-based model.
It's about human contact. I really believe in the importance of the human relationship as part of a healing process.
And that, I think, is where patient-centered, truly personalized medicine is going, and that's what we want to deliver here.
Casey Health Institute is a new nonprofit integrative primary care and wellness center located in the heart of the DC metro area that aims to change healthcare in America.
Philosophically, what we're looking for is how do we best treat the patient as a whole person?
And that it needs to come from every direction, and that all of our specialties can address a few of those points, but together we can really help create this patient-centered healing.
The future of healthcare is really changing the way that we deliver primary care and creating a way that the average person can access the broadest range of effective and safe therapies. Here at the Casey Health Institute, we have a lot of those options under one roof, and we have providers who utilize them collaboratively.
What makes Casey Health unique is that we are a community of healers.
I tell my patients that you're the expert of your life, and then I am the expert of psychological therapies and techniques. So if we can bring that together, that's when the true work can happen.
It's not nature or nurture, it's not mind or body. Both clearly interact and both have an impact on the other.
We really look at the function, how joints are moving, what muscles are activated, which muscles are inhibited, and ways to fix that.
If we can slow down the body, we can sometimes slow down that mind as well.
Not only physically, but mentally, emotionally, spiritually.
Everything in the patient's life, including where they live and who they live with, affects their health.
As a naturopathic doctor, I'm utilizing a lot of natural therapies that have very few side effects. We're focusing on preventative medicine. We're trying to get at the root cause of disease.
So our goal is to take our patients who come in with whatever illness or injury that they need our help with for, and not only get them to be free of that disease and illness, but also then take them to optimal vitality, to optimal well-being.
And so these modalities that deal with the whole person in a much more comprehensive way are very important, and they have thousands of years in many cases of experience about how do you promote health, how do you get back to health.
I really believe that we can make an impact in the way healthcare is delivered.
I don't think it's the only answer, but I think it's a potential big piece of the dialogue to change the paradigm of healthcare in the country.
We want to make a difference in patients' lives.